Hello, all, and welcome back to another NKF Live episode from the National Kidney Foundation. I'm your host, Marlena Chesner, NKF's Digital Content Development Manager. And today we are discussing hyperkalemia, or high potassium levels in the blood, a common issue for people living with chronic kidney disease, especially those in stage 4 or 5 kidney disease. Today I'm joined by Dr. Pascal Carala, a nephrologist or kidney doctor from the University of California, San Francisco, Dr. Annabelle Berute, a registered kidney dietitian, and Briana Douglas, a person living with kidney disease. So let's get started with introductions. Dr. Carala, would you tell us a bit about what you do?
Yeah, well, first of all, thank you for having me. It's a pleasure to be here and talk about this important topic. So, I am a kidney doctor, or also known as a nephrologist. I work at the University of California in San Francisco, and I basically take care of patients with kidney disease throughout their kidney disease journey. So, from the time they start to lose kidney function for whatever reason, and then if unfortunately they lose their kidney function, then I follow them while they're on dialysis. And finally, I also manage patients who have received kidney transplants. So that's my job in a nutshell.
Welcome. Thanks so much for joining us. We're really lucky to have your expertise here today. Dr. Berute, what does your job as a research dietitian specializing in kidney nutrition entail?
Yeah, so I've been for the last 13 years been involved in studying lifestyle interventions in people with kidney disease, in which we're really looking for interventions, lifestyle interventions, both diet and physical activity to improve outcomes, both for the management, limiting the complications of kidney disease, but also hoping that we can do some interventions for the prevention of kidney disease. So I'm really passionate about helping people with kidney disease.
That is so incredible, and I can't wait to hear all of your amazing insights from this research. Um, and finally, last but definitely not least, Brianna, could you give us an introduction to yourself and a brief overview of your kidney journey?
Yes, I've had kidney disease since I was 17 years old. I'm 35 now. I was diagnosed with lupus at 17, lupus nephritis. So it attacked my kidneys. When I was about 26, that's when I started. I was probably, I believe, around stage 4 or 5 um, kidney disease, and I had to start dialysis at 26. I was on dialysis for 7 years. Um, I've done every type of dialysis. I've done nocturnal, center-hemo, peritoneal, and then also the home hemo. I don't think I mentioned that one, but yeah, pretty much every type of dialysis. 2000, where are we? 2025. The years go by so fast. 2024, I received a kidney transplant, and yeah, it's pretty much been my whole journey.
Thank you for being here, and huge congrats on your transplant. That's what we hope all people can get. So let's start this discussion off. Dr. Carala, what is high potassium or hyperkalemia, and how does this relate to kidney disease?
When we talk about high potassium, or the medical term for it, which is hyperkalemia, that means that the patient has abnormally high levels of potassium in their blood, which is typically a level greater than 5.5 milliequivalents per liter. That's what you're going to read on your blood test. And potassium is this important mineral that regulates cardiac electrical activity. It's important for nerve signaling. It's important for muscle contractions. But whenever you have too much of it, then you can get into trouble. And so some of the complications of this high potassium level that our patients will encounter is a few things. So one, I mentioned that's important for nerve signaling and for muscle contractions. And so too much of it can actually lead to patients having numbness or paresthesias in their arms or legs. Patients can also start having these like muscle twitches that are uncontrollable, involuntary in their arms and legs. In more severe forms, people can develop weakness and even paralysis in their arms and legs. And so that's all very important and very scary. But what scares me more as a physician is actually the cardiac manifestations of hyperkalemia. So high potassium levels can lead to these EKG abnormalities. So EKG is how we look at the electrical activity of the heart. And it can actually result in changes in that electrical activity and cause sudden cardiac death. And what I typically tell people is, these changes, you might never feel them. And basically, just like 1 minute you're feeling okay, the next minute your heart will stop beating. And that's what makes hyperkalemia or hypotassium especially scary and something that we want to manage and keep an eye on and even prevent for the most part.
And why do we see so many people who have kidney disease, especially in the later stages, kind of struggle with high potassium?
Yeah, so if we think of how potassium is regulated in our body, really the main regulators are the kidneys. They make sure that if we take in too much potassium, the kidneys will get rid of that extra potassium. If we didn't take in enough potassium and our body needs more, the kidneys are going to be the ones to really try to hold on to as much potassium as possible. And so you can imagine as people start losing some kidney function, so some parts of the kidney aren't working as well as they should, for the most part, the remaining parts of the kidneys will try to compensate for those parts of the kidney that are now no longer working as well. But as more and more of the kidneys are affected, and that's what you mentioned with like advanced stages. So typically when people have less than 20% kidney function, that's when really it's hard for the kidneys to get rid of the extra potassium, and we start seeing more and more patients develop hyperkalemia.
That definitely makes sense. If your kidneys are the ones mainly responsible for regulating it, makes sense it would kind of go one way or the other if you have kidney issues. But Dr. Barute, are there any other risk factors for high potassium? And I'm wondering if the foods you eat play into that.
Yeah, thank you for that question. As Dr. Karla mentioned, there are several factors. Probably the most important one is advanced kidney disease or once kidney function is compromised, but there's also several others. We sometimes tend to blame food first, but there's other factors. Some medications may be increasing the risk of developing high blood potassium, like some specifically for blood pressure. Also, one of the adaptive mechanisms is for the gut to take over some of that excretion function. So in feces, people that have advanced kidney disease can excrete that. So if a person is constipated, it's also actually acting against that adaptive mechanism. And also, people with diabetes may have a higher risk because one of the key controlling hormones is insulin. And if there's lower quantities of insulin or resistance to that insulin, it's kind of like that key to bring the circulating potassium into the cells where we want the potassium to be. But going back to your question, if foods can impact the levels of potassium, that's probably the answer is yes. And particularly if we consume a meal that has high concentrations of potassium, it will influence the potassium after that meal. But it's usually just a transient increase, and then the concentrations go back to normal. But if we have risk factors like a person has kidney disease, diabetes, or is taking some of those medications, maybe that transient increase can take a little bit longer to go back to normal. So yeah.
Yeah, no, that makes a lot of sense. And I'm curious, Briana, when did you first start experiencing issues with high potassium?
I want to say about a year and a half in on dialysis, maybe, is when I really started to notice issues because, I wasn't really, we were, they told us what not to eat and things like that, but I wasn't too much educated on like the foods to avoid. So I was kind of hard headed too in the beginning. I was 26, I was younger. I was young, just kind of hard headed, not, and like with some people like myself, you kind of got to go through something to wake up, type of thing. So that was pretty much me. So I'm gonna say like a year in, I started noticing changes and issues and things like that. Yeah.
And, did your clinic catch on and start recommending treatment plans, or how did that work out for you?
They didn't really do treatment plans at first. My When I really realized my scare was when I had to get rushed to the ER. And I was actually at home. And if I can remember, I believe they may have told me, like, every time we got blood work done, they would tell me, like, your potassium levels are high. But to be honest with you, the center that I went to, they wasn't really too big on like really educating us like that. I mean, they told us little stuff here and there, like the basics, but I really didn't take, like I said, I didn't really take it that serious, and so I had to actually go through the experience myself.
Maybe you also didn't quite understand how bad the high potassium could be and how it
Exactly.
could affect your health and your life.
Yes, and that's what I'm saying, because I had to really go through the experience to really understand, and it was a nightmare. It was a huge wake up call because and I remember, because when I was on dialysis, I was a huge binge eater. Like, I would binge eat one thing and then go to the next and binge eat that, and it was like chocolate peanut M&Ms. I loved Oreo cookies, um, bananas, broccoli. I loved broccoli, and it was just like all of the foods that I love, we had to, manage, or just we couldn't eat a lot of. So that was it was really difficult. Oranges, and like, I wasn't really too educated in the beginning, so I was eating a lot of that, and my family wasn't that educated on dialysis. All of this was new for us, so they were just getting me whatever I wanted, and just feeding me all of the wrong things. And next thing you know, it started out with the muscle aches, the muscle weakness, um, like the irregular heartbeats, and then I remember like the numbness. The feeling is kind of indescribable. Like, I wouldn't wish it on nobody. And it starts to, like, when it gets bad, like really bad, everything starts to happen so quickly. And then I remember going to the bath, and I remember standing up and feeling really, really weak. My muscles and everything was really weak. And I told my mother, I said, "Mom, I'm not feeling well. Something is wrong." Like, my hands was numb. Then I started like shaking really bad. And so we called an Uber to the hospital. It was me, my mom, and my mom friend at the time. And I was able to walk to the Uber and get in the car. By the time we got to the hospital, my mom friend had to literally pick me up and put me in a wheelchair because I couldn't walk. And when I got back in the back, um, when the doctors and everything saw me and I got to the back, my numbers was like at a 9 point something, and they said they don't even understand how I'm still here. And so it was just a miracle. It was just nobody but God that brought me through that. Yeah, so it was tough.
Yeah, and it's one of those things where the normal everyday person doesn't know about potassium. You think, oh, it's in a banana, and that's about the extent of it. So, yeah, it's definitely not your fault that you weren't given that education. And kind of bouncing over, Dr. Carala, what should maybe have happened? How is high potassium usually treated? Are there medicines involved?
Yeah, so, I'm sorry you went through that, Brianna, and it seems like your level of potassium was very, very elevated. And of course, not everyone presents with as much of a high level of potassium. And so the treatment does depend on basically where your potassium is, how high, how acutely it went up, and whether someone is on dialysis or they still have some kidney function left. And so in general, if I see someone in the clinic and I check their labs and their potassium is a little bit above normal, there are some things we can do to try and lower it. So for example, if we see that they are on a medication that might cause an increase in potassium, we might want to either stop it temporarily or permanently, or maybe just reduce the dose of the medicine. We do have also medications called potassium binders, and those are medications that are not so new anymore, but they did come out in the last 10 years and have been a game changer. Patients take them orally, and they kind of bind to potassium in the gut, and that's how they prevent the potassium from moving from your intestines or gut into your bloodstream. And then if someone still makes urine, you can also give them diuretics or water pills, which make them pee out some of that potassium. So, those changes are, or those like medication changes are okay for people who are not in that like super dangerous potassium levels. But if someone has a potassium usually above 6 or 7, that's when your doctor is probably going to you and say, go to the emergency department right now. Because as I mentioned earlier, a lot of this high potassium can cause sudden cardiac death. And, Briana, you were lucky you had symptoms and you knew to go to the hospital, but a lot of patients do not get symptoms and their first symptom is sudden cardiac death. And so, we tell patients go to the emergency department. That's when they might get intravenous insulin, intravenous calcium, inhalers, and other medications to kind of drop the potassium very quickly. And then if everything we do doesn't work, that's when we might have to do dialysis to kind of clean that potassium quickly, get it back to normal, and avoid the complications.
And do you make any actual changes to the dialysate, or is it just choosing to do an additional treatment?
Yeah, so you're asking about patients who are on dialysis, like those patients who get dialysis regularly and their potassium, even though they're coming to their sessions, they're getting their full like 3.5 hours, their potassium is still high. So the dialysate is that solution that we use to kind of clean the blood of dialysis patients, and we can adjust the potassium level in that. But sometimes even with adjusting that, it's not enough. And that's when we might ask people to do longer dialysis sessions. Sometimes we might ask them to come for more frequent sessions, as you mentioned. And then we can also add some of those like oral potassium binders that they can take every day to try and work with dialysis to keep their potassium levels within normal. And then, of course, really making sure that their diet is not very high in potassium to try and prevent those dangerous increases in potassium levels.
Yeah, and picking up on the nutrition aspect, I do know a lot of foods have potassium in it. So Dr. Barute, how do people, eat what they love still, or just eat anything at all while managing their potassium levels? And does it depend on the person's disease stage or dialysis modality?
Yeah, thank you for that question. And I would say that the first thing as a dietitian or what a renal dietitian would do is assess with a diet history, a very comprehensive diet history, in order to know what types of foods that particular individual is consuming. As you mentioned, like potassium is really in a lot of foods, and usually we tend to focus on plant-based foods like fruits and vegetables and maybe some nuts and legumes because they're good sources of potassium. But if you look into the restrictive foods like do not eat, it's usually fruits and vegetables, which is not very conducive to a healthy diet. But potassium is really in a lot of other foods. Animal-based foods like meats also contain potassium. Dairy foods also contain potassium, but it's really based on what the individual is consuming. I try to be a dietitian that it's inclusive of what people like to eat. And instead of focusing just the total amount of potassium that a food may contain, is trying to focus on the things that we can do in order to include those foods in the regular diet. So for example, if a person likes bananas, or if a person likes some of the fruits and vegetables that contain higher concentrations of potassium, maybe work on a lower serving size of that, and then consuming a little bit more often during the day. Instead of, for example, having 2 bananas, maybe have a banana with something else. If a person likes beans and legumes that are also good sources, there are some cooking methods like wet cooking methods like boiling or double boiling that may lower the concentrations of potassium in that food. Now, I've been a dietitian, and when I was trained, we were trained on a very restrictive diet for patients with kidney disease. And luckily, that message is evolving more favorably, and we are promoting more of a liberal type of diet with the specific caveats of it. So try to be conscious of the serving size, try to use some cooking methods that may lower the concentrations of potassium. And also, we are learning from research that the way that our bodies absorb potassium is different in different foods. So, for example, the fruits and vegetables, the concentration of potassium may be higher, but the amount that our bodies are able to absorb is lower. So, we take that into an advantage to include those foods into an individual's diet. Also, unfortunately, now we're seeing a lot of more potassium additives in food. So, for example, if a food is low in sodium, they are likely using, instead of salt, just sodium chloride, they're using potassium chloride, which is actually more readily absorbable or more easy for our bodies to absorb. So now some of the education techniques that we utilize is teaching patients how to read labels and trying to avoid those that contain these potassium containing additives. So those are some of the techniques that a renal dietitian which we're usually use with an individual with kidney disease. And also going back to your other question, does it matter if a patient is not on dialysis and then with dialysis modalities? Yes. So usually patients that are undergoing hemodialysis 3 times per day. Usually we are a little bit more restrictive because dialysis is just intermittent versus if they're doing home dialysis, which may be more days during the week, or peritoneal dialysis that also occurs daily. Usually the diet is a little bit more liberal.
And this is why it sounds so important to find a kidney dietitian, because you gain all these incredible insights. Briana, I'm curious. I know that in the beginning of your journey, you didn't really pay attention because you didn't understand the significance of managing your potassium. So after your hospitalization, were there any changes that you made or had suggested to you?
Yeah, definitely. I've definitely slowed down on processed foods, chocolate. And like she mentioned, like eating a half a banana, things like that. Because on dialysis, I loved eating fruit, and that was my favorite. And it's just funny now that I got a transplant, how your diet, things really like change. It's like a whole 360 with stuff. But I love the bananas, so I would just do like a half a banana. We did have a dietitian at dialysis, so they did come out often afterwards to give me like a lot of information on like different foods to eat, things like that. So yeah, and I'm like a huge research person myself. So, just kind of like researching on like things to eat, like looking up different recipes that I can make to kind of make it, better, easier, so to speak. Yeah.
I am curious if we have any advice for those who maybe do need to take their medicine every day to help manage their potassium. Do we have any advice or thoughts on that?
Yeah, I can get started as a doctor, as a physician. I just think about my own experience whenever I've had to take medications. It's actually really hard to remember to take your medicines. And I felt like the best way I can remember is to add it to like my routines. If I wake up and have a coffee every morning, that's when I should take my medicines. And that helps kind of remind me, or if I take a shower every evening, taking them after my shower. So kind of adding them to a routine, to something you do every day can help. And I do tell my patients to put alarms or even use applications that kind of remind you of when to take your medicines, because we're all busy during the day. You're not going to remember to take your medicine. And then I do make sure to tell my patients to get pill boxes and organize their medicines like on Sunday for the rest of the week. And that helps you like stay on top of it. But also like if at 5 p.m. you're like, did I take my morning medicines? I can't remember. You can look into your pill box and see if they're still there. So those are things I tell my patients to do, but curious to see what Briana and Dr. Birwate do.
What I used to do, I usually keep my medications even now wherever it is that's my comfort spot in my home, like it's my room. I keep it at my nightstand, like at reach, like where I can see, like where I know I'm gonna, always remember because it's like right in my face. So that helps for me. A medicine tray, that helps. I put it in areas, like I said, where I can see it, where I'm, where I probably like my most comfort spots in the house. Um, yeah, that's pretty much what works for me.
I would say, I mean, I don't prescribe medications, but like just thinking about experiences, like for example, with my grandpa, which actually he was on dialysis and he had a lot of medications. It's really good to have a schedule, and that also works with your meal plans and having a schedule for meals. So if you're having like your breakfast, lunch, and dinner, and if you have medications that go with those meals, like for example, I know we're not talking about phosphate, but with phosphate binders are usually taken with meals. Potassium binders, I don't think they're the same, but having a schedule so you can remember, that also works on your favor to try to limit bigger peaks in potassium. So if you have a consistent meal, you can break it down across the day rather than having a big bolus of potassium in one sitting. So just like being consistent with your foods and also with your medications, having your schedules. Alarms, probably like Dr. Carla mentioned, like are probably good because a lot of people can forget. I mean, if they're taking many medications too, it's hard to remember if you did take them or not.
You can add it like maybe, but one thing to note about potassium binders, was the talk today is about potassium. It might be even more important um, for those medications to be linked on the alarm because typically, so they bind potassium in the gut, but we do worry a little bit about them also binding other stuff that may be helpful for us. And so when we ask patients to take them, we usually want them to take them at least 2 or 3 hours apart from other medications. So I tell people, if you usually take your medicines in the morning and the evening, try to take your potassium binders like around noon, because then you're not like risking the absorption of your other medications. And I know at when people are at work, they're living their life. So I think a way to remember them is important.
Yeah, no, that's some really good advice for people out there who need to take that medicine. I'm also curious, do you have any advice for people who maybe need help accessing that medication? It sounds like when and how you take it's really important. So, if there's some access issues, that could really cause a problem.
So by access, you mean like patients who cannot afford the cost of the medicines, or maybe the medication is not covered by their insurance. So in those cases, I do tell people, like, if I don't know that you're having an access issue, I can't help you. So you need to let your doctor know, whoever's prescribing it, maybe your pharmacist. And I was surprised when I started practicing in the US, when I found out how different the price of a medicine can be in different pharmacies, or how if I order the medicine in like a formulary form versus a generic form, the cost can be like so different. And so I tell patients, like, if you show up to the pharmacy and it's expensive, just don't pick it up. Let me know. I'm sure I can find a way to prescribe it maybe to a different pharmacy or under a different name where it will be much more affordable. If that doesn't work, there are a lot of online coupons that I even personally use, where like sometimes using them makes the medicine cheaper than using your insurance even. And then there's a lot of patient assistance programs if all else is not working. And especially for patients who are established at the dialysis unit, there's always social workers and case managers who can help you apply to these patient assistance programs if it feels like too daunting to, like, where do I even get started? There's always help, so please ask for it.
Absolutely. And I think this actually rolls into the next question really well, which is, do we have advice on how to have these conversations with our healthcare provider? And I'm wondering, Brianna, if you'd like to start with that.
My advice would be any questions or concerns or and things that you may have, maybe like, take note of it and put it in your notes. I don't know. Some people like to use their phone notes. Some people like to actually write, like old school. I'm old school, but take it to your doctor Ask questions. It's a lot of help at your dialysis center. You have your counselors, the techs, even the techs, the doctors, the nurses. Don't be scared to ask questions.
Absolutely. Anyone else?
Yeah, I think that's great, like asking questions, because if I don't know what your concerns are, or what is it you want to know more about, I really can't help as much as I'd like. I think the other thing that will help me be a better doctor for my patients is if they tell me all their symptoms, if they tell me if they're skipping their medicines, or if they're having a hard time accessing them or having side effects from them, because if I don't know, I can't really make changes. And knowing your medications, that's probably like at the top of the list. A lot of patients will not know what they're taking, and it makes it really hard for us to be able to adjust their medications or maybe make changes that would help them even more. So those are all important. And if you feel like the information when you show up to the doctor is too much, it's too stressful. Some patients you know, um, can understand a lot, but a lot goes in these conversations we have with our patients. So maybe bringing a caregiver, a sibling, a child with you who can, like child as in your children, adult children, who can, help you just navigate the whole process would be helpful.
I will echo whatever Dr. Carla and Briana said. In terms of like a renal dietitian, just like try to tell them as much information as you can. Sometimes some patients or individuals may be scared to say, like, for example, what types of foods do they really enjoy? And you can work with them in order to allow and encourage and even include some of these foods that we sometimes tend to think that, oh no, the dietitian is going to tell me no. For example, chocolate. Maybe we can include a little bit of chocolate and not be so restrictive, because food it's nourishing, but it's also a part of just like your daily living, your social life, etc. So whatever we can do to make it as best as possible is probably going to make everybody happy. And dietitians are really there to work with you on this end, and also to work with the healthcare team.
I just wanted to add, only you know your body. You're the person that's on dialysis, dealing with kidney disease and so many other things. We're blessed to have doctors and dietitians and professionals to be able to have the knowledge to help us, but it's your body. You have to listen to your body and love your body enough to be honest with yourself first, and then be honest and just ex- express how you feel and what you're going through and what you're struggling with. And then the professionals can then help you. You got to help them to help you. And, yeah, whatever that may be, whether it's you struggling with diet, taking your medication, depression, anything, is help out here. I'm a peer mentor with the National Kidney Foundation, and I wished I would have heard about it during my journey, because I definitely would have been on board. I just realized how it helps, me being a mentor and helping others. It makes a difference. You can change lives, and it can change your life. Um, just reaching out, just taking a step and give it a try.
Those are some really lovely words of advice. To those watching, if you have any questions that we did not get to, please feel free to post them in the comments section of the social media platform you're using to watch this program. We will do our very best to answer them within the next few days. As always, thank you for tuning in and sharing your time with us. I'd also like to thank our sponsor, AstraZeneca, for their generous support in making this program possible. On behalf of NKF, we wish you all good health.